So that's
So
Plan G.
moving
Now to option 2, these are Medicare Advantage plans. Medicare Advantage is also known as Medicare All-in-One plans because they literally just puts everything into one card. They're also known as Medicare Replacement plans. Although they don't replace your Medicare, you have to have Medicare to even get them. But what they mean by that is they become the payer of your bills. So rather than a doctor's office billing Medicare, they're going to bill the insurance company that you have your Medicare Advantage plan with. They are also known as, let's see, Part C. So because they literally are Part C of Medicare. So we have Part B up here. We have Part D down here on our red side. And what happens is you bring those two together and you've magically got Part C of Medicare. These are the Medicare Advantage plans. It's all the same thing. You hear so many different terms. It's one thing, Medicare Advantage Part C, okay? Part C plans are contracted Medicare plans, just like Part D is. Now, Part C plans can have drug coverage. Some of them don't because maybe you get your medication benefits through the VA, or you get it through TRICARE, or maybe you have a really big penalty for D, and sometimes you don't want to incur that penalty or pay it. And so you can take that out and not have the drug coverage if you want. Most people need it and have that in their plan. These plans are funded by Medicare. So in 2 ways. One, they're funded by you, really. You pay your Part B premium up here. And when you have a Medicare Advantage plan, that amount that you paid gets transferred down to the Medicare Advantage plan that you choose to help take care of you. So that's why these plans are now responsible for paying your bills rather than Medicare, even though they are Medicare plans, okay, the Medicare Advantage. Another thing is these are funded by the federal Medicare fund. So they receive money every single month to take care of you. Now, that's how they're able to include many of the things that you don't see on this side with Medicare supplements. You have dental, vision, hearing. Many plans have over-the-counter benefits, such as a credit for things like vitamins or ACE bandages, adult underwear. There's a lot of things that you can get with those kind of things, canes, walkers. Some of these plans also include transportation, gym memberships. There's a lot of stuff in these plans. They're pretty darn great. And that's also how they're able to give you a plan that many of them are no cost to you. So you always pay that Part B premium, but then these plans either are zero or a really low premium.